I can feel how frustrating it is to have a child that is difficult to handle at home, and then parents have to work, parents balik, kalau anak throw tantrum, kadang-kadang kita pun tak boleh hold on to our, so we get frustrated, and kita pun baling ni, and kita pun tercakap, then after that we're like, oh, I'm sorry, so it happens, yeah.
Yes.
Oh, maybe you should go and see a psychologist, and they're like, why, you think I'm crazy? Hi, welcome back to the next episode of by the Children's Protection Society.
Hello, welcome.
Hi.
Nice to see you again.
Hi, Kumin.
Hi, Nawiza. Nice to see you again.
Nice
Haven't
to see
seen
you
in a while.
Hari ni kita ada special guest. Our special guest is a child play therapist, Miss Sri Ram Seetha from MAPAC, Malaysian Association Peds Palliative Care, and Abri Mental Health.
Yes.
Welcome, Miss Seetha.
Welcome to our show. Thank you.
Thank you for having me here.
It's our pleasure. It's our honor to have you here. So today's topic, we're going to be talking about rahsia dalam rumah.
But before that, can you introduce yourself and tell us about
what you
anything
do.
about you? Yes.
Okay. So basically, I work with this NGO, which is Malaysian Association Pediatric Palliative Care, and what I do is I actually see kids with different rare diseases where they just can't go to school and they are at home, bed bound and all. And so I do give play therapy sessions for these kids as well as for their siblings, because sometimes in this kind of cases, while the family is focused on the patient, which is a child who's sick, they will forget the siblings.
Oh, tapi Miss Seetha, the children ni, dia orang datang ke center ataupun Miss Seetha yang pergi ke rumah?
I pergi rumah.
Okay.
It's a home. It's a home visit thing that we do. Yes, because they can't come.
Betul.
We will do the session at home, and then with the siblings as well, we will also do the session there. And at the same time, we will also do family session for the parents, because sometimes they do not know the communication. Correct. They do not know what to say. So sometimes they are like, the gap gets bigger because they know the child is suffering. They do not know what are the right words or how, and then that child can't communicate because sometimes they just can't speak. So the gap will be just a normal surface talk, like, okay, we makan, saya buat susu dulu, the parents will ask, but underneath there's no talk there. So that is why we put the family session, the bonding session. So sometimes the therapy will be like, we get the mom and the child to do like a clay session. So the mom will hold the child's hand, because when the child can't move, so you hold the child's hand. So we already seeing the touch. The communication is in the touch.
Okay.
Yeah, so that's the therapy that I do.
Okay.
Yeah. And then I also do the grief session as well, grief and bereavement, because once the sick child passes away, we don't leave the family anymore. We still journey with them, and we will continue the grief and bereavement session there with them.
Until they're okay.
Yeah, because sometimes the siblings may not say anything at the beginning, but during the grief and bereavement session, they actually will talk out, or they will just cry uncontrollably at times. Yeah, so this is part of that MAPAC work. Whereas in Abri, I actually do with other kids, like trauma, divorce cases, maybe abuse cases that I do get as well. Yeah.
So at your abuse trauma cases, right? What kind of abuse? You don't have to tell us specifically. Tapi the ones that come into you, what is the pattern?
The pattern normally, you see, kids, they are not like us. Mereka bukan macam orang dewasa. Because orang dewasa kita boleh cakap. We have our significant other to cakap, or our good friends. But children tak ada. They don't know the words to tell. So it shows in their behavior. So what sort of behavior that we can actually, if you really observe something is wrong, is when they actually go into a very withdrawn symptoms. That means they just like, they answer you with one word answer, or they don't answer you at all. Or the aggression comes in, like sikit-sikit the marah. Maybe you just put one cup there, but that's a trigger point and they get angry. And you'll be wondering, why are you getting so angry over, I just placed a cup at the corner. but maybe something has happened there with the corner or the positioning of a corner. You know, so something probably the child has gone through where the child has been placed in a corner. So when they see corner, they get triggered.
I see.
So they show in behavior wise. So that's why many of them, we look at them like an iceberg. Actually, if we look at people like an iceberg, we only see the surface, right? The tip of it. They say, you know, and then we label them. We say, oh, they are lazy, they are, you know, naughty. We put all this label, but underneath what is happening there, it's a lot of things. You know, we have the uncertainty. Like if I deal with kids who are going through death, they have uncertainty. They don't know I'm going to see my parents or not. If I'm dealing with kids who are abused, they are fearful because even though I am in a household of not being safe, but I'm also afraid to lose them. So that's another thing that goes on for that child as well.
So Miss Sita punya the children that you see, how young are they?
As young as 4 years old, right up to teenagers.
So they orang dah boleh bercakap lah.
Yes, and some of them are non-verbal actually because of the trauma.
Okay.
They tak boleh verbalize. Maybe verbalize 1-2 perkataan je. Tapi they have a lot to show. So it comes out in the play.
So bila Miss Sita cakap about they are traumatized or they go through trauma ni, jenis kalau boleh specify dia jenis trauma yang macam mana ni?
Okay, the trauma that they go through can be the physical abuse.
Okay,
and sometimes it can be abuse where you don't see it physically.
Verbal
abuse. So these kids actually they will show it in their play, and how they will show it in their play is that sometimes when you see a child is playing aggressively, you will just think it's for fun. But there is a theme that is coming out there. So, like for example, in play therapy, when we do a 12 session first. We always start off with a 12 session process. Why 12 session? Is because in one session we can't get to know what's happening. Because one session the child is also testing us to see whether can I trust this adult being in the room with me. In the 12th session, we'll pick up themes of what is coming out in the game. So they can be playing, they can be having fun in the room because they see a lot of toys, they see a lot of things I can mess up with, sand, clay, everything. But indirectly, they're showing what's really happening.
So proses, kalau katakan Miss Sita kan, Miss Sita jumpa budak kan, you do therapy dengan budak umur 4 tahun. Berapa lama jangka masa tu yang Miss Sita kena ada dengan this particular child dan boleh tengok the difference that he is getting better?
Okay, so very good question actually.
I don't know.
Yes, I know a lot of parents also ask like 12 sessions, can you actually see,
Yeah.
It depends on the trauma, and also it depends heavily on the household support we get.
Okay.
So when they come in for therapy, we need the support from the house as well, because therapy only happens once a week, seminggu sekali.
Betul.
So it's 30% there only. 70% is the household.
Seminggu sekali 1 jam saja kan therapy
1 jam,
saja.
yeah.
Okay.
So but consistently, setiap minggu we have to see them. Then 70% is more of the home that comes in, because the people that they know at home. If this works, then the therapy both will go hand in hand, and then the child will actually feel very safe to let out, to tell out, and to be seen and heard. Finally, people are seeing me, what I'm going through. But if that 70% we don't have, this is where we struggle. Therapists actually will struggle more because we don't have
help.
this, and then support. We have parents coming and being against us as well.
Oh,
yeah. So when that happens, sometimes we will have no choice but to sometimes stop the session, because it becomes a very like a big argument.
Ada lagi satu question lah, tapi saya tak tahu Miss Sita boleh jawab ke tak. I'm like trying to think about so many things. So Miss Sita, okay, having children who are yang telah gone through trauma, mentally abused, verbally abused. Obviously, Miss Sita pergi ke rumah, you do therapy with them, and then you get the parents to also cuba,
Communicate.
to commit that 70% to them. Have you ever come across parents yang at the end of it they just cannot handle it anymore, and you know that, okay, you know, this child is not going to get any better because
The parents
are actually
not helping them.
the parents are actually mentally abusing them or verbally abusing them at home. Have you had a case like that?
I had numerous cases.
Okay.
Like that.
I just wanted to know that,
Yes.
you know,
Yeah.
because I know how frustrating, I mean, I don't know, but I can feel how frustrating it is to have a child that is difficult to handle at home, and then parents have to work, parents balik, kalau anak throw tantrum, kadang-kadang
Yes,
kita pun tak boleh hold on to our, you know, so we get frustrated and kita pun baling ni, you know, and kita
yes.
pun tercakap, then after that we're like, oh, I'm sorry, you know, yeah, so it happens, yeah?
Yes, it happens.
It does.
And I guess this is because of our society and cultural, how we are actually, you know, being our Asian society lah, basically, when it comes to emotion and mental health thing, is like, no, we don't talk about that.
Yeah.
You just have to be strong. You know, and the word mental itself is already
It's
you
a
know,
negative.
yes,
They,
you know,
it
it's always
brings a
associated,
negative connotations to it.
Even like you now is a little bit better.
Yeah, now it's better. Yes,
Dulu,
true.
oh, maybe you should go and see a psychologist, you know. And they're like, why, you think I'm crazy? You ingat saya gila ke?
That's true.
But now everybody, they're like, therapy, yeah, I will go for therapy.
Yeah. So it's getting there, but we are
Better.
still not
Yeah.
there yet. Lah.
Yeah.
But at least we have some parents coming forward because they know that there's a problem there, and they want to like just nip it in the bud already, you know, like very fast. And, yeah. So with that part, we actually look at it in a good way.
Miss Sita, how long, dah berapa tahun dah Miss Sita dalam this
line
yes,
of
this
duty?
line?
Okay, initially I was actually teaching. I was in the teaching line. 14 years I was teaching.
In school?
In school, international school.
Okay.
Then I did special needs education. So I was doing in the curriculum support. Then about 8 years now, including the training and all that, into play therapy. So I went to clinical setting. Now is my 6 years lah. It's coming into the 6 years in clinical setting.
Do you enjoy what you do, Miss Sita?
I do, because I know I'm giving the voice for the children to be heard.
Oh, thank you.
Because at the end of the day, we need to hear them.
Yeah.
We cannot let them be, you know, like just push them aside. They need to be heard, because when they grow up, they are bringing this along.
Yes, you're right.
You know, we actually bring our trauma to adulthood, and when we are not regulated in adulthood, it affects, the chain reaction goes again,
Yes.
and the vicious cycle just, you know.
When you don't address it, it continues.
True.
So the kids, as you said, the kids would need time to open up, right?
Yep.
So how do you get them to trust you, to show that you're a safe adult that they can trust and open up to? How do you do that?
So I follow their lead in the session. So when session starts, I will not tell them like, oh, today we're going to do this, today we're going to do that. No. Whatever that's there in the room, I will let them to choose. So when they choose, they are allowed to, for example, now if just say they take this phone, okay, for us it's the phone, right? But they can say it's a bar of chocolate. It's a bar, or it's a rock, it's a stone, it's a brick. I will not correct them to say that, no, this is a phone.
Okay.
So I allow them to actually, because I will view it as what they are viewing. I will look through their lens. So I will go there, and then from there I will hold their space. And if I know it's already the discomfort is coming, because you can already see the body is getting tighter, and then they feel a bit like, okay, I don't want, or sometimes they will just like throw it off, you know. Then I will actually hold their hands and say, okay, you know what, let's take a breather. Because I know it's something that's going on inside. It's too much for you. You're breathing heavily. Let's do a mindful breathing technique. So I'll get them back again, anchored down, grounded. Yeah.
And how do you do that, Miss Sita, to get them to calm down again?
To do the breathing technique.
Oh, there's a breathing technique.
What is
yes.
this breathing technique?
So basically, you inhale, hold it up for 4 seconds.
Oh, 4 seconds.
Let go for 4 seconds. And then inhale again for a second. And Let go again for a second. And the stomach, when you inhale, it has to kembang.
Because angin masuk.
Tak boleh kecut macam ni.
Pasal angin sepatutnya masuk, you kena kembang.
Yes, so and then when you exhale out, then you kecut like a balloon lah, basically like a balloon.
So what does this do?
It
calms you down.
It calms you down for a moment because you're giving them to be grounded for a while.
That's
to
why
be present.
That's why orang kata juga kan, kalau kita marah, take a breather.
Yes.
Yeah, just breathe, right?
True.
Okay.
So 4 saat. Breathe in 4 saat, breathe out 4 saat.
Min, you kena buat lebih sikit.
Ya, itulah.
So they call it like a
tense.
box breathing lah.
I'm very tense, so probably like 10 seconds kot.
Yeah, but don't do the fast way lah, because fast way then people think like by doing this like that's okay, but no, that actually brings in more anxiety actually when you do it.
Why do sometimes they breathe into a bag?
Because
ada kan?
But so that's like the focus point lah.
I see. Okay, faham.
Yeah.
Okay, so these kids, right? Okay, I've asked you about how you approach them, but how do you really get them to open up? You know, a lot of kids, they're very traumatized. They don't percaya anyone. Diorang tak percaya anyone. How do you get them to open up, and then you find out, oh, actually this is what she is suffering from?
Okay, that's a very good question as well. So in session, we actually do metaphorical play. So we use symbols, and when they draw, so we actually they use like metaphors to actually explain what is going on. So with that metaphor, I will also join in to ask like, who is this? Like, if just say it's like if just say it's a century part that they did like a war thing going on. So I will ask, who is this character? Because I see it very dominant. So they will give one name, but after that they will relate it slowly. When they feel there's a safety net is there, they will say, just like my dad. This character is strong like my dad. He likes to fight. So it's already indirect. I'm not forcing it on them. I just ask like, who is this? You know, I didn't say like, oh, does this resemble someone at home, or represent? I don't like put a directive there, but they yourself will tell. So then the story will come up slowly from there. Then each session they will actually open up a bit, and then finally like the bigger ones will actually say like, today can I talk to you about my family? They won't play anymore, but they'll say, I feel like telling you about my family.
So at every session, Miss Seetha, you actually have a solution for them or an advice for them, or how do you?
We basically give them to find the solution,
I
but
see.
we are there to hold their space if they're finding it very overwhelming for them. So we will direct them. Actually, we are not fixing their problem, but we are directing them to see how you can be resilient by making your own decision. So whenever there's like a game going, I said, so what is for example, just now the dominant character.
Yeah.
So this part, another character that's probably slightly smaller. So I said, so how is this going to fight with this dominant character? Then they will try to figure out. They will look around the room to find, okay, what can I put in? Then they will try to get something. Then later they'll say, but maybe I also can do this when someone talks to me. Then I will say, but you can't take a stone and hit the person, you know.
Yeah.
So what else can we do when we are angry? So it directs back to what they are feeling, but in an indirect manner. Yeah.
Miss Seetha, so the children that go to you are children who the parents would send, or do you have cases referred to you by like JKM?
Like now from like cases like the ones who are sick that I'm having, usually the hospitals they will refer, and also we also had like social JKM also in the hospital because we know the family is like a bit, there's something going on, so they will actually refer to us as well.
So with that, right, the child was abused ke macam mana? Can I ask that?
Yeah, in a way, yes.
So the child was abused. So
I've done the session on making the child to regulate, because the child was actually a cancer patient.
Okay.
You know what, Miss Seetha, therapy is very good now, and whatnot. Tapi masalah dia dengan therapy sekarang kan, cost dia tinggi sangat. You know, I was speaking to ada kawan semalam cakap, dia kata, you know, they need help with, you know, therapy, tapi therapy mahal sangat. Satu jam sampai RM700, you know, and all that. I don't know what kind of therapy that is lah. Tapi how would the less fortunate be able to afford this therapy?
Okay, like the one that I'm doing in Maypeg, it's free.
Okay.
We don't charge them because it's the B40 group that we actually doing.
So you Miss Sita dapatkan kes-kes ni daripada welfare ke ataupun hospital kena refer?
Yes.
Okay.
Because we have like a medical team, so they will refer and then they'll refer to the hospice nurses and then they will come to us lah.
Tapi proses dia panjang kan, Miss Sita kan?
Not really, because here we are quite fast actually, because in the hospital we have already got the palliative team there, the doctors there, so when they know that there's a need, they will immediately refer to the hospice team.
Okay.
So the hospice team will then take over already lah to do the nursing part and then the medical part and then the psychosocial part. Psychosocial here we also have like the physiotherapists coming in and all that. Yeah.
So Miss Sita, kalau macam kita ada kes macam budak ni dirogol bapak, you know, lepas tu dia dah trauma, lepas tu dia di sexually abused by another family members, lepas tu tapi dia tak pernah pergi therapy, you know, dia try to just live with it, tapi tak boleh, you know. Do you take such cases?
Yeah.
Or you do take
But that will be on my will lah. I will take it on my own thing.
Faham.
Yes,
And with that also you do macam sessions, sembang and all that lah.
Yes, yeah.
Okay, so you do. Okay.
So how do people contact you?
Wait lah Miss Sita. Age wise you can take sampai ke umur berapa?
It's like from 4 years right up to teenagers like 16, 17, 18.
Oh, lebih pada tu tak dah lah. Boleh juga.
Boleh if they are willing to do in the creative setting form.
Faham. Okay. I hope all of you heard that. You know, these are all good information sebab banyak parents yang saya dah pernah jumpa, dia orang kata memang nak hantar tapi mahal. Lepas tu kalau pergi hospital pula dah buat appointment, lepas tu doktor kata lagi 2 bulan baru datang balik nak tengok boleh bagi medicine ke tak bagi medicine. By that time I think the child also will collapse.
The regression will happen.
You know.
Yes,
so you know
2 bulan is actually quite fast. I
Is
think
it?
the wait list is 6 months.
It's
6
longer,
to 12 months.
ya ke? Oh no.
So
Ada sorry saya nak tanya lagi. Ada macam bantuan tak? Bantuan yang any organisation ke company bagi untuk budak-budak yang perlukan terapi tapi ibu bapa tak mampu. Ada tak?
That one I think certain NGOs I'm not really I have
not
not
sure.
come across
Okay.
it yet as whether free.
Okay.
But I do see sometimes like they will just put like, you know, like trainee counselors or something that, you know, they will provide free sessions.
Okay.
Yeah, but we haven't like done like I haven't seen yet like the play therapists coming in like
Okay.
that. Yeah.
Okay. All right. Okay.
so
But maybe this can be a start though.
Yeah, you know, I'm thinking pasal ada banyak kes yang, you know, nak pergi, you know,
See a therapist
government
is
hospital pun lama nak tunggu. Nak pergi personal pun dirang, you know, satu session tak cukup. You know, you kena dua session sebulan sampai you okay. You know, susah juga.
True.
So, you know, it's like you know, kadang-kadang terasa jugalah, you know, macam mana kita nak tolong. Yeah.
True.
Okay, sorry Min.
yeah. Okay. Miss Sita, bagaimana peranan you rasa peranan as a trauma counsellor membantu these kids in the healing process, or like kids and families lah?
Okay. So as a play therapist, because I'm not a counsellor, so I'm seeing in the lens of a play therapist, child play therapist. Trauma play therapy actually helps deeply and greatly for families who have gone through it. Why I say that is because the gap has reduced. It bridged the gap lah basically, and families now actually see that they can communicate with their children better. So like cases that I see, some of them, when I do get resistance before from the parents, actually after that they will come and ask.
They will come
and meet me, and they'll come and ask like, do I need to see someone, or do I need to, you know? And I will say yes, better, you'll see better if it's you're having problems with your husband, get a counselor for couple therapy, and so I will guide them in that sense.
So mula-mula dia orang hantar anak dia orang because dia orang fikir my anak ni masalah. Tengok-tengok actually
they are the masalah.
The problem is me.
Them, yes.
So
they actually see that.
That's good.
So a few cases I had where they actually saw that and they changed in that manner lah. But of course we still have some who's just like very in denial and very defensive lah. We have to be very tactful when we talk to them lah. Yes.
Okay, Miss Seetha, why do you think this why do you think these parents, what is happening with themselves that they can actually abuse? This is from your experience kan. Why do you think they abuse their children, or like, mental ke physical? Why do you think they do that?
Okay, if I'm looking at the B40 community, because I've worked with this group, I would look at child planning lah. Because suddenly when you talk to the parents and you're already having a sick child, and then you already have few more kids who are there,
younger,
and then suddenly we know that they're pregnant again, and then when we ask like why, I don't know, it's just unplanned. So one is the planning, I think, because once it becomes unplanned, they are more stressed already. Because one financial additional
another
costs,
another
mouth to feed. Then I've got the sick one to take care. Then I've got another 2 more. So that is one. Secondly, when we got to know like families like this where medical thing is more for the child, we always see like the husbands sometimes they can't cope lah. I would look at it that way, that they probably can't cope with what's happening. They seek for a divorce or something, so it becomes like a single mom thing already after that, or vice versa, the other way around, that the man becomes a single mom to
single
take care,
parent.
single parent and stuff like that. So this is one of that in the big 40 group, one of it. I guess for the other part, when we see others who are abusing, I guess it's the lifestyle. Like if they are earning too much, they want to be the best, then they send the kids like to every structured play. You need to go here, you need to go there, so the child doesn't have a free play thing, and then when the child rebels back, the stress they can't handle. Because they say, I got work, I need to do this, I've got, so it's also that routine check thing that goes on there. It's a lifestyle that we're also living in.
Okay. Do you remember there's a case this year? Case the parents kurung anak dia dalam sangka anjing. Budak 12 tahun.
Yes, correct.
Do you know about that case?
Yeah.
Okay. Why do you think parents tu boleh buat macam tu ke anak-anak dia, and what is the trauma that you have dealt with many cases, the trauma that the child would go through if she doesn't seek help? Okay.
I think locking up someone in any form of room is already traumatizing. And what more like a cage, It's like it's resembling to, you're like an animal basically. So for the child will actually, eventually the trauma will lead the child to be very compliant to people. People pleasing will happen. And this is where relationship can go wrong. Because if the child is a female, they will look for a father figure relationship. And when I say father figure, it's not father.
Understand. Yes.
So it becomes that sort of relationship that is not healthy. But they think they're already getting that love and he's like a father to me, even though, so that inappropriate thing will happen. Likewise, I think for a male also, if it's a boy, it will be the same thing. They will seek for something, or they will do something more aggressive. The bullying will start. So that would be the trauma effect. So the cycle will go back again.
Correct.
So it's not going to end. It's a vicious cycle. Whereas for the parents doing it, I guess one is, like I said, they don't plan properly, the family planning. So financially they get stressed. They've got a mouth to feed, or sometimes they just do not know how to handle the child because of the communication breakdown. So they think by doing this, I'm actually controlling, because the parents themselves would have gone through some trauma in their childhood. So they probably wouldn't have resolved that, so it's carried forward here. Yeah.
Generational trauma being
Yes.
carried out.
Yeah.
So Miss Sita, let's just say for example, right, budak ni kan yang dikurung dalam sangka anjing ni kan, budak ni datang and then kita bawa budak ni out of this environment ke environment yang lagi selamat. Let's just say children's home ke apa kan. And budak ni, and because of that, because budak ni dah dibawa keluar untuk be put in a children's home, so katakan sekolah pun nak kena tukar, they have to change school because they would have to be schooled somewhere nearer to the center. Okay, example lah. Lepas tu budak ni cakap, how would the child feel? Okay, sorry. How would the child feel that you already dah ambil saya daripada my comfort zone, which is my parents' house, even though I'm locked up in the cage. Sekarang ni you are trying to rescue me, tapi you also took me out from an environment yang saya rasa yang selesa sangat, because I feel selesa with the cikgu and my friend, and you putting me in this environment. So as parents or either caregiver, how do we go about there? What should we do to a child like this? Is it right for us to take the child out from the comfort zone, which is the school that she's used to, macam dia punya friends ada kat sana, dia punya cikgu yang dia boleh trust, and give her a new life, tell her, okay, you know what, leave everything behind, let's just start a new thing? Or either you can't take a lot of things away from them at one go.
You can't take a lot of things away from them one go. So in this case, if they have brought the child out of that unsafe environment,
Yes,
they should hold on the school changing part.
I see. For a little while,
For a
kan?
little while, because of the transitioning, because this already is a transition. A very traumatic transition took place here. So now when you want to change a place where I have got a teacher, I've got teachers, I've got friends that I can actually talk to, and suddenly you're taking me out to somewhere new, I'm not going to feel safe. Because I'm already being not seen. So you're not seeing me at the end of the day.
So at the end of it, you think the child's going to grow up not being able to trust people anymore?
Yes, the trust issue will be
And
there.
then how would you think a child is going to be able to behave after that? I don't know. It is sad, but so like
So
what?
this is why, like I said, the regression will happen in behavior.
Yeah.
The child will either go in a withdrawal syndrome, so where they will just be on a shutdown mode, or the child will be in an aggressive mode, or the child can have both. Very confusing. One time you can talk, one time you can't
So
talk. Yeah.
your suggestion is, nasihat is jangan ambil everything
Think
from the child.
yeah. Talk to the child first. Ask the
Faham.
child, actually. Include the child. Okay, now
In
that
the
I've
decision making,
yes,
kan?
I've now brought you out. Now you're safe because you're no longer in the cage. Okay, so now what would you like to do? Talk to the child. Listen to the child. Hear the child. Look at the child first, because the child was not seen in the cage.
Yeah.
You put me like a invisible thing in the cage there, right? So now that you saved me, I want you to see me first as a person. So whoever's there to give that to that child first.
Oh, okay.
Yeah. Then after that, slowly, then if the child says, okay, I don't feel safe because my parents know where I'm studying, then maybe you can ask, so do you think you want to change or what?
So at the end of it, kita ni tak boleh asingkan budak-budak. At the end of the day, kita kena, budak-budak boleh bercakap dengan kita kan. We have to speak to them.
Yes.
They will be able to make us understand how they feel. Betul tak? If you shut them out immediately macam tu, then they are going to not trust you or trust anybody, and they're going to feel that my life is just going to be ruled by people, and what I want does not matter.
Yes.
And she's going to grow up to become a rebellious child.
Yeah. So speak to the child, not at the child.
Speak to the child,
Speak to the child.
not at the child. So don't give instructions, but listen.
Ask them. Be curious to ask, what are you thinking about? Because every time we are imposing things on them, thinking that, we know best. But sometimes they know also what they need,
Do you think, Miss Sita, the children's NGO would need a therapist, child therapist in every of their NGO?
Oh yes, definitely.
Yes.
Most definitely. Yes.
Yeah? Do you think that every school as well should have a child therapist? Yeah, but at the moment we don't.
We don't have enough.
Yeah, we don't have enough. But they do. Every school and NGO that handles handles children should have a professional child psychologist
and therapist or
in-house.
counselor. Yes.
Okay.
So, okay. As you said just now, I wanted to go back. Speak to the child, not at the child. Okay. So, budak-budak sekarang kan, we always, you buat ni, you buat tu. And and what we are essentially doing is kita bagi instruction, kita tak dengar dia orang. And that's why they rebel.
Yes.
So, how do we fix that as adults?
When we talk, we are talking, most of the time we are talking this way. We are looking down and they are looking up, right? We get to their eye contact.
Yeah.
So we go eye level with them. So we either sit them down and then we talk to them.
Yeah. I truly believe that because I've seen parents, I've got friends, family members as well, lots of friends. There's A and B, and I can see. And I've always said, do this, don't do that, because you're going to eventually get a child who can trust you and tell you everything. Yeah, don't ignore your child.
Yes.
Talk to your child.
Yes.
Your child is your friend. I mean, borderline kena ada lah. Tapi at the end of it, you kena cakap macam anak you, kawan you. Macam dia boleh cakap dengan kawan dia. True. Because it's better for your child to cerita dekat you benda-benda yang that is disturbing him or her rather than dia bercerita ke kawan dia. Betul tak?
True. Yeah, so that's how we just have to be eye level with them.
That's
I think it applies to us as well as adults. I don't think we like people being
Talking down on us.
Yeah,
Betul?
we don't like this, right? In any form, in a organization form, in working, even at home.
Yeah.
So I think for kids, it's even that actually.
Miss Sita, do you have a statistics of how many children with the work that you do that have this sort of reported cases? Ada tak?
Actually, tak ada.
Tak ada.
Because they are afraid.
Tapi with your working experience dah 6 tahun, Miss Sita dah jumpa, do this therapy for, ballpark number.
Yes.
Berapa?
Oh, more than, I think I already reached about 1,000 lah.
1,000 lah. Just cases.
Yeah, just cases.
Yang tu pun you seorang saja kan, Miss Sita kan?
In my
your
capacity
thing.
lah.
Yeah, just imagine, right?
Yes, yeah.
Okay, because that's all that you can handle, betul tak? Tak boleh lebih-lebih, nanti tak balik rumah tak tidur kan?
Betul.
So we should listen to the kids.
Yes.
And then we should not silence them.
Nope.
Tapi a lot of parents kan, anak-anak nak cerita. But then the parents macam, I tak ada masa lah nak dengar masalah you.
Yeah.
I have so many problems on my own. I nak cari tu. So the child pergi orang lain, you know.
That's how they find. Sometimes they find another figure like the parents and whatnot. And kalau orang tu pedophile, best ah, betul tak? Dah ada target, betul tak?
True.
And at the end of the day, at the end of the day, you're like, you're a pedophile, you did this to my kid, but why did your kid find somebody like that? Is because you don't. Yeah, you push them away.
True. Because the moment you don't want to listen, they already won't talk to you already. So I think I know we all go through our moments. Like we are working adults, we have a lot of things that goes around. But when a child decides to talk, sometimes we just have to put whatever and listen and just be with the child. Because only then the child will know that, my parent is here.
Tapi betul Miss Sita, because saya pernah experience the same thing too. I mean, me and my daughter, kita memang best friend. Cakap-cakap. Tapi when it comes to like, my daughter nak cakap, sekejap. And she's like, Ma, I want to talk to you, Ma. And she would be telling me, you're always on your phone, Mommy, and all that. And then I realized, you know what? She wants my attention. And she only wants 10 minutes of my attention. So I learned that. I actually went for a course as well, parenting course when I was in England as well. And they orang kata, you have every day, if you are a working parent, every day bagi 15 minit untuk
Yes,
your
that's true.
own child.
Yes.
Just give 15 minutes. And trust me, after that, you go on to give more time to your child. That's one. Lepas tu, I was also taught in this course that if you have 3 anak, you don't go outing, you ingat outing bawa 3 anak sekali, it's okay. No, you kena bagi attention to every single one of them different time because they are different individual.
Yes.
Betul tak, Miss Sita?
That's what I tell the parents sometimes.
Saya pun boleh jadi terapi.
Yes.
Yeah.
But this is one part we tell the bonding because they are 3 different individuals. So you need to spend time. Like I had actually a case where the child wants to sleep and wanted the mom to sit, and the mom was like, "No, I can't do that because it's night. She has to sleep, on her own and stuff like that." And when I asked the child, actually, you want your mom to sleep with you? She said, "No, I just want 10 minutes of her time."
Yeah.
So then I told the mom, I said, just 10 minutes every night. What is the harm, And then now it's okay.
I mean, I can summarize this, right, Min and Miss Sita, it's the parents. The parents plays a big role in a child's life and how the child will behave and how the child reacts to things is the parents. And I always say in the first episode kan, kalau ada time kalau anak ada anak kena ada time. Kalau tak ada time jangan ada anak, tak payah. Dunia dah ada banyak dah sangat budak-budak anak-anak, tak payah. True. Betul tak?
That's why child planning.
Yes,
You said
child
planning is important because banyak cases is because child planning, tak ada child planning, so masalah datanglah because tak cukup time.
Yeah, child planning. Okay.
Unplanned, so they
It's always unplanned.
True.
Anyway, Miss Sita, thank you so much for your time.
Thank you.
I think dalam episod ni kita dah belajar banyak cara-cara yang kita boleh avoid, a child, being mentally abused and whatnot. I mean, in certain cases, but in your cases, it is special children that you're dealing with, and we are very thankful to have people like you, Miss Sita, to help the children who are really in need because they are born that way. Betul tak? They are born that way. They don't deserve to be treated differently from another child, and they need help. And you are there. I was very
all of you
grateful.
all here as well advocating it. So
Yeah. Okay. Hopefully we can work together.
Hopefully too.
Yeah.
Yes,
Kalau ada apa-apa, we will give you a call.
True.
Yeah.
Thank you so much. Yeah.
Thank you so much, Miss
for
Sita.
having, and thank you
Thank
so
you.
much
Yes.
for coming.
Thank you so much. Yeah. Thanks.
How can people contact you actually?
Actually, you can call through the Maypac line. Actually, you can look at find us on the line. Yeah, Google us up. If not, you can contact my number 016-363-7310. So you can actually call me then.
Thank you so much,
you
Miss
so
Sita.
much.
Thank you.
Thank you.